my name is Regina and I had the procedure slightly less than a year ago on August 4th of 2020. I first started noticing the pain when I was about 7 or 8 months pregnant with my first child. He will actually be 24 this weekend. I was actually walking in a grocery store and the pain took my breath away, and had I not been pushing a shopping cart, I actually would have fallen to the ground. I did visit with my doctor multiple times, and he kept telling me, oh, it's because your hips are spreading, because you're pregnant, you're 8 months pregnant. It'll all go back to normal. It'll be fine once you deliver. Everything will be fine. It did not. And then it got worse with my second pregnancy, and she is 21 now. So it's been 24 years that I essentially have battled the pain. And I would say the last 5 years or so before my surgery, it was pretty much a nonstop, constant onslaught of pain. It affected vacations. It affected how far I could ride in a car for how long at a time without stopping to stretch my legs. I had to get out and walk. Sitting or being non-mobile makes me hurt worse than moving. I, of course, would start with my primary care. They didn't know what to do with me, so they would refer me to a pain specialist. I actually went through 3 pain specialists, and then finally I changed primary care doctors, and he started me in physical therapy, to which she recommended I go for steroid injections. And that was the first time I had had any of those. And through trial and error, that radiofrequency ablation worked, but it was very short term. My insurance only allowed for it to happen every 6 months, and it would give me about 3 to 3.5 months of relief, and then it would start to come back. My life before I would get relief, whether it be from steroid injections or radiofrequency ablation, in the interim, if you will, was a lot of pain. Going from heat to ice, back and forth, not a lot of getting out and doing stuff. And then after I would have the radiofrequency ablation, like I said, I would get about 2.5 to 3 months of relief. And during that time, I honestly felt like a new person. And we even would plan our vacations to where it was a week or 2 after my last RFA. So that I would be in the least amount of pain possible. And living from RFA to RFA to RFA is no way to live. It was during one of my follow-up visits with my pain management doctor that she did say, I think you have what is called SI joint dysfunction. And she referred me out to the surgeon and handed me some pamphlets. I went home and researched what exactly is SI joint dysfunction, how does it present, how does it look? And I had a few reservations at first, but I was living every 6 months at that point. And if I have somebody who finally says, yes, I do think this can be a long-term solution for you. And when I woke up, I had no pain shooting down my leg. I had walked in the hospital that morning with pain shooting down my leg. I woke up and it was gone. I did not have the radiating pain down my leg. Had a great night's sleep for the first time in a really long time. And within a couple weeks, I was able to start putting weight on it and walking on it. And it probably took another maybe 2 to 3 weeks before I felt comfortable getting back out and actually walking the block and stuff like that. But the pain has never come back. I mean, I'm slightly under 1 year, but this has been the longest amount of time I've gone without pain in a very long time. I'm looking forward to not having to plan vacations around RFAs, around pain control procedures. I don't consider myself a super active person, but even sometimes just shopping, going to the park, those kind of things were painful. And so I'm thankful that this has given me that relief to where I can do those things. I can plan those things. I don't have to worry about, am I going to be able to make it through the day? I definitely got my life back.